Oh, there we go. Um, we just moved up to a different screen. Good morning, everyone. It's good to see folks. For those I haven't met, I'm Beth Truzansky. I'm the Deputy Director of Building Bright Futures. And we are here for our Goal 2 Strategic Plan Committee. Goal 2 of the strategic plan is all children are raised in safe, healthy, and healing environments. And so excited for presentations and discussion about kind of two pieces of the system that we are doing some investigation and redesign, in part um, funded by the most recent preschool development grant, with funding for 2026. So I am going to just do a quick review of kind of what parts of the strategic plan are we talking about today, and why are we focusing on particular parts of the plan? And then we're going to hear from Courtney and Laurel from Department of Mental Health about plans to improve the infant, early childhood, and family mental health consultation, um, and other supports for early educators, children, and families. Um, and then we're going to hear from the Mathematica team, who are hired by the Department of Health to, they're doing work around Vermont's coordinated intake and referral system. So on the report that they just finished, and are releasing, and the phase 2 of the project, which is also funded by PDG. And then we will finish, we'll just with a end of meeting pulse to get a sense of like, what did we hear? Were there some patterns? Were there some particular issues? Because one of the goals of this committee is to really monitor the implementation of the strategic plan, identify where there's progress being made, where there are barriers, and sometimes those barriers might be policy changes that are needed. And so this committee has the ability to kind of move along or elevate issues into policy recommendations. So that is a part of our process that we tend to do. And so would like to, if there are policy gaps that we need to be thinking about, and then those policy recommendations get shaped kind of usually in like August, September. So the focus of this committee is goal 2, but some of the issues that we're talking about today really kind of span across the whole plan. And this is just a little bit about the committee, but I'm going to keep moving pretty quickly because we have a lot to cover. But the big picture vision of the strategic plan is that every Vermont child thrives in safe, healthy, and nurturing environments supported by strong families, a valued workforce, and coordinated system that puts children at the center. So that's kind of our big picture vision, and then the plan has lots of detail in it. So I pulled out just not all the places, but just a few places where we see the kind of issues or the parts of the system that we're going to be talking about today. So in goal 2, ensure equitable access to comprehensive mental and physical health. We are talking about universal screening, ensuring that children and families have access to the services that they need in a timely and trauma-informed way, that we are continuing to work on timely access to mental health treatment, and also thinking about where's the most appropriate setting. So that I feel like that's part of what we're talking about today, is how do we bring services to kids and families and providers where they are. Moving on, let me see today. Another part of goal 2, talking about promote health access and sustainability. Again, we're talking about sustaining programming that supports both primary care and health access, and responding to patients' mental health needs. And here we're referencing consultation for around psychiatry, which is not the specific program we're talking about, but just like this idea that when capacity is limited, consultation is a very creative solution to get there. I'm Stop me if I'm moving too fast, but just giving you a broad brush stroke. In goal 3, we talk about strategies to reduce the use of exclusionary discipline. And one of those, we want kids to be successful where they are. Needing to move programs is traumatic. And so again, the consultation, as well as a coordinated intake and referral system are some of those ways that we try and connect providers and families with the services that they need. So that's in goal 3. And then goal 5, we talk about again that goal 5 is supporting families seamless transition. Well, this objective is around seamless transitions across services, resources, supports, and education. The specific strategy is ensure that families can find and access the services they need. And we talk about investing in a centralized, coordinated intake and referral system so that families have access to the services they need. So that was your 60 miles an hour tour of the strategic plan as it relates to, let me stop sharing, hang on. Struggling. That's weird. I'm struggling to stop sharing. Hang on. There we go. Okay. Wow. I felt stuck there for a minute. So any questions about kind of just trying to place it in some of our bigger picture vision as we hear about kind of progress around these 2 pieces? Any questions? All right. Well, why don't we dive in? Would love to hand it over to Courtney and Laurel, and we have, let's see, what's our schedule? We dedicated about the first half, so about until like 9:40. So if you want to share, and then we can pause and ask us if there are questions, and then we'll move on.
It's great. We can introduce ourselves first, and then Courtney has a slide deck that she'll share and we'll dive into. So I'm Laurel Omland. I'm the director of the Child, Adolescent, and Family Unit at the Department of Mental Health. And part of that is the early child and family mental health services provided through our designated agency system. Courtney?
Hi, I'm Courtney Fitzpatrick. I am actually in the operations unit at DMH, but a portion of what I do here, as well as also as a grant manager for our PDG project, which we're going to be talking about today. And I'm going to try to share my slides, but I feel like I'm less familiar with Zoom now, so let's see if this works.
It's all right. We can talk you through.
I think that's going to work. Yes?
Yes. We see the slides on the side too. It's not in presentation mode, but it's fine.
What is that looking like now? Is that looking like presentation mode or?
No. Did you hit that from the beginning?
Yep.
Okay. You might have to switch what screen it's sharing.
No. And Beth, how did you get out of screen share?
At the very bottom, there's like a stop screen share button that I think is green.
Well, this is fun.
It's fine.
I'm not seeing that. Let's see. What are you seeing now?
Still the same.
Okay. Oh,
full PowerPoint.
Yep. Let's try again.
Got to yesterday.
Haha, you got it.
Working? Yeah. You should practice that first. Hey, Laurel.
So we have a small portion from the preschool development grants. That is a 1-year grant through the calendar year. And what we had proposed was that we would use it to engage a national expert to work with us and help us figure out how to really strengthen our early child and family mental health system, in particular the area around consultation with childcare. So the goal here in the PDG, the Preschool Development Grant, is that we will build a coordinated mental health, social emotional supports framework for early care and education settings. So but this is where we'll just dive into it in more detail. So if you want to go to the next slide, Courtney, or is this where you want to pick up?
Yeah, I'll just talk about some stuff here, but again, you can jump in to add. You're seeing the next slide, right?
Yes.
I have like 3 screens and I don't actually know what anybody's saying. Okay, so in terms of why this was an area that we wanted to focus on for this year, we look back at the key findings from the 2024 Early Childhood Needs Assessment, where access to expert guidance, specifically infant, early childhood, and family mental health consultation. I think for the purpose of this presentation, we're just going to refer to this as consultation, so it's less wordy. But that really varies across the state and in different regions. We know that from the needs assessment that programs face challenges responding consistently to children's developmental needs. Families experience fragmented pathways to support, and early childhood workforce needs more predictable training and in classroom guidance. And so, in terms of the work that we were doing in the most recent PDG project, this was an area that we had funding to hopefully support and expand some of the consultation, not only that already existed in regions, but also those areas that there was either limited or no service. And we found through that 3-year project that programs were still really struggling to kind of build this up or expand. And so while we invested in 4 programs, 2 of them were existing, pretty well developed consultation programs in their regions, and 2 were able to kind of build some small capacity. But really, we saw some limited progress there. So our goal for this year's PDG is, as Laurel was saying, to really kind of look at, we know what some of the gaps are and what some of the barriers are, but what do we do to really achieve that goal of increasing capacity and access for every child and family and every early childhood program across the state. Okay, next slide. I've already kind of talked about our goals. And Laurel, jump in definitely. Yeah. It makes sense. But so the goal for this project is to build a coordinated statewide framework that addresses access to professional supports in each region, in each type of early childhood learning environment. So one of the other things that we built into this is that, to be a coordinated statewide framework, we know that there are also other services that either align or complement consultation, including what's happening in Head Start programs and also other services such as early MTSS. And so looking at that whole kind of system in addition to consultation. That this strengthens early learning environments, supports children's social emotional development and well-being, promotes early relational health, and equips educators with practical ongoing support. You have anything to add there, Laurel?
Yes, I wonder if it would be helpful for folks to kind of understand, like the current structure for this is there's some challenges around how it is kind of supported for sustainability. And that's also part of what we're really hoping to get some guidance around. Because when we look at, our designated agencies or CCBHCs as we move in that direction, providing early child and family mental health, there's only a portion of that work that can be supported through Medicaid, which is our primary fund source. And so those that had some capacity under the very long ago federal grants of CUPS were able to kind of build it and figure out how to build that in. And so the resource kind of has stayed at the same level in each region. So the regions that weren't able to build it in those early phases have had less resource to develop it since then. And so we want to be able to understand, like, how are other, when I and Courtney talk with other states and hear what they're doing in this, there are some other creative ways of getting at how to provide this consultation, not just the clinical services of therapies and skills development that might be covered by Medicaid. So how do we, when you're providing consultation to an early care and learning site, it might be about a specific child, which might be billable under Medicaid, but it really more often is about how does that early care educator understand how to respond to the behaviors that they're seeing and the dynamics between kids, and also how to engage with the families about how to have that continuity between those responses from home as well as those settings. And so how that's funded, if it's a more generic consultation, that's not something that Medicaid can cover. And so that's why we really want to understand, like, what are some of those approaches and models of both doing the consultation? What are we bringing to that? What structure can we offer to those agencies who maybe don't have as much foundation in how to actually do the consultation, and what guidance or guidelines might they follow with that? But also, how do we, as a system, structure this and fund it and set it up in a way that we can continue to sustain it? So that's really, thanks for advancing to the slide. That's like the crux of we know what we want, we're just not quite sure the best way to support it in the long term. So we want to engage a consultant who has some knowledge about what goes on in other states, what structures exist. We have a lot of information, thank you, BBF, around kind of what the needs and gaps are from the needs assessments. And so bringing all of that together. So we're not going to want the consultant to spend their time doing that more in-depth needs assessment because it's already been done, but there might be some additional gaps for them to take a look at. We want to engage folks in that process, and then start thinking about what are those different approaches and what makes sense in our system, that we can start to figure out. And I'll hand it back to you, Courtney.
Sure. I think we've kind of gone through quickly through a lot of these slides. So, and I have another slide that will get to this, but it feels like this is the right place to talk about where we are with this project. Is we have put out an RFP now, and that's posted and it's active. We're closing it mid to late April. And we'll see what we get in terms of proposals from organizations to do this work with us. And some of the things that we talk about in the RFP is that the assessment will examine, what I talked about before, like what are the existing classroom-based guidance consultation models that Vermont's using right now. What are the training, coaching, and reflective supports available for the workforce? I think the other thing that we wanted to make sure is that, there, like Laurel said, there are areas of the state right now who have had kind of long-standing consultation supports in place. And so part of what we want to be doing with this is not getting rid of those, but building on. And we know that for some of those regions, they're using both clinical and subclinical consultation supports. And so kind of looking at that as well. And then also the regional variation that we know about in terms of access and capacity. And then, when we talk about a coordinated statewide framework, what does that mean and what does that look like? I think this will evolve through the work, but I think what we know now is that, um, or what we want from this is that it establishes a clear vision and guiding principles. It ensures consistent access to the appropriate levels of support across settings and regions. And again, as Laura was talking about, there are those different levels and different needs, and so not a one size fits all, but this coordinated framework of supports that a child or family might need, or a setting might need. It strengthens the workforce in terms of knowledge and confidence. It explores a statewide training and consultation model. So this was also something that feels key for us in terms of being able to build a system and sustain it. Is what is the training and supports that won't be needed ongoing. So those might be conversations with higher education and looking at what other states have established for that. It considers the other social emotional supports, like I talked about, that exist within the system. And key is also identifying sustainable funding strategies. I feel like we're repeating things that we've already talked about. We've talked about most of this. I think the other key thing for us is that through all of this is that, that our goal is to ensure that all children can thrive in early learning environments, and that central to that is that we're really shifting away from the focus being about managing behavior and more to supporting participation and belonging for all children and families. And that really is key to the consultation model, and something that we'll want to make sure exists through this project. Talked about this a little bit. So our RFP is posted. The proposals are due by April 21st. We anticipate the contract will start, we hope, late spring, and we'll get into the work of this project. This is kind of a outline of what we think is next. It's things could shift a little bit in terms of timing, but we anticipate that this spring through summer we'll be onboarding the consultant that we choose, doing some project planning, and then the stakeholder engagement launch, which is another really important piece of this, is being able to hear from stakeholders and gathering that information. That summer through fall, we'll do the landscape analysis, and that will be presented by the consultant. Review of national models, funding and feasibility, and then towards the end of the year, that's where we'll draft and refine the statewide framework and identify implementation and funding strategies, so that by the end of the year we have kind of a next steps for this project that we're going to move forward with. I'm going to stop there, Laurel, to see if you had anything you wanted to add.
That's great. I actually put the RFP information in the chat as well if people are curious about it or want to spread it to anyone you know.
Thank you. And then we also just thought it would be important to kind of highlight where Beth kind of did this in the beginning, but where this work aligns with the strategic plan. So strengthening family well-being, promoting nurturing and inclusive early learning environments, and supporting a skilled and competent workforce. I think also, obviously, this is funded through PDG. So looking at where it aligns and advances the PDG priorities. So statewide coordination, early childhood system stability, and increased family access and choice. That's it. So Laura, I don't know if you have anything you want to add to that piece of it, or if we want to move to.
I think we can open it up for any questions or comments.
Resume recording. Okay. So we're going to move on to hear a little bit about work to improve our coordinated intake and referral system. Emily, do you want to give us a little bit of framing, and then we can hand it to Mathematica, or what?
Yeah, sure. Hi, everyone. I'm Emily Smith. I'm the Director of Evaluation at the Division of Family and Child Health at the Department of Health. And we have wrapped up phase one of this work. We were really lucky that we were able to get this body of work off the ground in the last year, well, more like the last 6 months, I think, of PDG round one. And we were able to bring a contractor on to help facilitate this body of work, wherein we took a deep dive into what our current system of intake and referral looks like in early childhood and come to hopefully a consensus and now moving into phase two on where can we improve that system of intake and referral? Where can we better integrate our systems, centralize if possible, coordinate if possible, and maximize use of resources. So Mathematica was a wonderful partner in phase one. That report is, hopefully being published in the next week or two in its final format. It'll be up on the PDG website. And we've convened a fabulous task force to continue this work as we move into this next year of PDG. So with that, I will hand it over to our partners at Mathematica, and they can give you the details of what has taken place in phase one and what we're really looking forward to here in phase two. So Anna and Jess, I will hand it over to you.
Thanks, Emily. Can you all see my presentation and hear me okay? Okay, awesome. Thank you for the intro. Good morning, everyone. Thank you for having us at this meeting today. My name is Anna Marston. You may have seen my name in your inbox many times at this point, and I'm the project manager for the Vermont Coordinated Intake and Referral Systems Study. And joining me today is Jess Harding, our study's senior advisor. I also want to give a big shout out to our project director, Kathleen Feeney, and our assessment lead, Davis Strasky, who both could not be here today, but you will definitely also hear from them over the next several months. I know many of you saw our draft report from phase one, and for those of you who had a chance to skim it, you know there's a lot of information we learned so far. And with the short amount of time we have together today, we'll focus on providing some high-level overviews of our key findings from phase one, as well as a preview of the work we'll be supporting this year under phase two of the project that Emily mentioned. And we'll protect a good block of our time for discussion and Q&A so that you can help shape our next steps. And we'll be zipping through some slides today, so we welcome you to add any questions or comments to the chat as we go, or jot them down for yourself on the side for the Q&A at the end. And we'll start by looking what's come into the chat. I won't go through this slide verbatim in hopes that many of you have seen this before in some state, but we just wanted to acknowledge how impressed we've been by the passion, commitment, and dedication to providing the highest quality and most equitable services possible for families in Vermont. And we hope that this session can be an opportunity to really highlight that passion, but also stay focused on actions for where we can make the system better in the future. So we really appreciate your willingness to let us join today and share both strengths and weaknesses that we heard about. So to start, I'll first begin with a quick overview of our study's objectives and methods. As previewed in the meeting agenda, the CIR Systems Study is a collaborative research effort to better understand the unique landscape of Vermont's intake and referral system that supports early childhood services. And you'll see throughout our presentation today that our research questions really focused on understanding what the system map looks like, so understanding the agency and organization roles and the pathways through the system. We also wanted to learn about family and provider experiences navigating the system, and to learn about the system's current strengths and opportunities for improvement and streamlining. Our first step in the study was to build a sort of repository of key documents and materials, and reviewing these documents to give us a really strong baseline understanding of the system before moving into our data collection. So in addition to those resources, we also reviewed the in-depth qualitative data collected with families and providers from the most recent iteration of the FCH needs assessments. And this data was so rich already. And because our study was, as Emily mentioned, about 6 months, we opted not to do our own focus groups with families themselves and used the secondary data that was already collected to inform this work. So we prioritized collecting data from various state and provider partner groups, including many of you today. And in only about a month of time, we heard from 57 individuals in interviews and focus groups, which was really awesome. And we were really excited to meet many of you. So this is the data we analyzed to establish the findings and recommendations that we'll present in this presentation. And before we get into the research questions, we just wanted to acknowledge that all of you here today know that goal 2 of Vermont's Early Childhood Strategic Plan is that all children are raised in safe, healthy, and healing environments. And before we talk about the recommendations, we just wanted to acknowledge that a more centralized early childhood system will ideally help Vermont increase access to supports for families with young children. And making the system more coordinated and easily navigable to families with young children will in turn help children and families get greater access to supports that foster health and safety and resilience and ultimately help children grow into healthy adults. And families who are usually not able to get connected to services will more easily become connected, such as earlier intervention and other community resources that they'll be able to better access. So with that, starting with our first research question, we wanted to understand and map the current intake and referral system around childhood services. So first, looking at types of referrals, we heard during data collection that the state's no wrong door policy really emphasizes the fact that families can enter the system of early childhood care from numerous access points, many of which are listed in this visual, varying from networks such as Help Me Grow, Find Help, 211, to local community resources like libraries and playgrounds, to the service providers themselves. And we also know that CIS coordinators do a ton of regional outreach that assists with proactively getting families involved in CIS services. In this slide, this map shows the open feedback loop that really emphasizes that no wrong door approach, where families can enter the system of care from an outside referral source and or by getting involved with the direct service organization first, with Help Me Grow and CIS serving as 2 pathways for potential care coordination, where Help Me Grow could funnel down from a statewide access point and CIS is focused on regional coordination. And as many of you probably know very well, the no wrong door approach ensures that individuals who are seeking assistance can access what they need, regardless of where they are in the system or where they enter it. And our report includes more detailed maps of these referral workflows once they get to Help Me Grow and or CIS. And we also have some interesting family perspective pathways through the system in the report. Finally, for research question 1, the report also highlights some key partners in the system, including both state agencies and key partners in the nonprofit sector. And this is a non-exhaustive map, but was our best attempt at mapping it out. I won't spend any more time here except to refer you to the final report once it's published if you're interested in digging into these some more. So next, I'll get into research question 2, which is what we learned about families and provider experiences. So I'll start with what we learned about families from a review of the state's needs assessment data that I mentioned earlier. As a reminder, our team did not collect data from families directly in this project, but we relied on this data that had already been collected by FCH. Generally, from this data, we heard that families are satisfied with the intake and referral process, and we picked out themes like building trusting relationships with staff and providers and good communication as major facilitators. But families also face multiple challenges along the way, specifically with finding services or accessing them due to availability or cost and completing duplicative paperwork. There were also some mixed results on the extent to which intake and referral systems reflect family-centered, equitable, and culturally responsive practices. So this is something we're keeping top of mind as we shift into phase two. Next, I'll share what we learned about our families from our interviews and listening sessions. We interviewed service providers who work directly with families and implementers of intake and referral services who oversee services but don't necessarily work with families directly. So these folks reflected on their perceptions of families' experiences, and some also shared experiences that they had as a family or a parent within the system, which was really cool to get that dual perspective. And they noted that the system is designed so that while the intake and referral processes may be complicated for providers, such as navigating various coordination steps or eligibility requirements, the goal is that it should be simple and straightforward for families to navigate. We also heard that not all referrals lead to service right away. Some folks describe situations of delayed services or needing multiple referral calls before getting services. And families navigating services for multiple or highly complex needs, or even for multiple children, can be especially confusing. And they may not know where to go for which services. They may need to fill out duplicative paperwork and more like that. So, lastly, to wrap up this research question before I pass it over to Jess, I'll share what we learned about providers from our data collection. We interviewed some providers of early childhood services who reflected on their experiences with and perceptions of the system. And we use the term provider here to describe someone working directly or providing services directly to families, so not doing intake and referral. We heard from providers that building really warm, trusting relationships with the families they serve is critical for success. And the report outlines some of the concrete strategies they employ to do that. We also heard that there are inconsistencies in how providers refer families to services, which isn't terribly surprising in a no wrong door system. We heard some use Help Me Grow or regional CIS coordinators, while others may prefer to refer directly to the service providers. And some providers shared that even they have a hard time understanding all the services available to families, or that they have difficulty navigating the eligibility criteria across services and regions when referring families. Lastly, we also heard from providers that they don't always know when the loop has been closed, and knowing whether or not the families they have referred for services actually get those services. And they express that that's very important to them. So I'll pass it over to Jess for research question 3.
Great. So I'm going to talk about some of the system level barriers and sources of duplication that we heard about. And the first one is that CIS uses both a central access point in the regional coordinator positions, but also allows a no wrong door approach. And this allows flexibility for referrals, which is great, but we heard that it can make the system potentially complicated to navigate, like in instances where a CIS coordinator is out of the loop about a direct referral to a service and therefore can't close the loop. We also heard that this flexibility can create tension because there are expectations for coordinators to meet certain case rates and receive a majority of referrals, which can lead to a scarcity mindset. Because CIS services are managed regionally, one challenge that we heard is that the quality of and access to services can vary greatly based on location. So while that means that some regions have really great coordination with entities like parent-child centers, other regions might not be able to offer certain services. I think we heard this from what Courtney was saying earlier as well, that access to consultation, for example, varies across regions. And so you can see this quote, where you live determines how much treatment and which services you receive. We heard that data was another pain point, and Beverly also raised this as a challenge. So currently, CIS regions share case data with the state, but the process lacks some consistency, which can make compiling statewide data time-consuming. Beyond CIS specifically, organizations in the broader early childhood system often cannot share data. So it can be up to local folks to arrange data sharing agreements, and that can be difficult as policies change. So shifting to Help Me Grow, as we've heard, this currently serves as a statewide central access point, but it's not embedded in specific regions like CIS is. And some folk express concerns that it can take referrals away from CIS. The initial process used by Help Me Grow that required connecting directly with a family first led to some slower referrals. And this process is now being successfully streamlined, but some perceptions remain that this is slow. Otherwise, we heard mixed experiences with Help Me Grow, where providers who are not really embedded in the system find it really easy and simple to use. But for those who are embedded, it can feel duplicative since they already know one another. And finally, staff at Help Me Grow talked about wanting to partner more closely with CIS to help meet needs, but not necessarily feeling like they've had many chances to be involved in coordination and state level decisions. They want to collaborate to serve families, but don't want to feel like they're expected to be a band-aid solution for bigger issues that remain in the broader system. So some of the other current pain points are that the current system has multiple procedural and regional borders that can be tricky to navigate, like different age-related cutoffs or regional boundaries. Next, CIS fiscal agents have specific caps for non-Medicaid funds they can be reimbursed with for serving non-Medicaid clients. And so once that cap is met, they either cannot offer the service or have to offer it for free if it's required. The system's braided funding model can sometimes result in unnecessary complexity for families, like having to redo paperwork if on the back end services switch between CIS and the Department of Mental Health. We also heard that the system faces persistent challenges around program awareness. As you know, staffing retention and turnover in both CIS and external partners can impact knowledge in the system. And then finally, folks talked about there being a lack of shared understanding of common terms and being unsure if everyone in the system shared a vision on how to operationalize some of its key features. Beyond current challenges, participants also shared concern about changes that would result in too much coordination, with a fear that some efforts to centralize services in the past had led to slowdowns and re-siloing. So we see this quote, we've seen the state try to centralize services and programs and other efforts, but it in turn gets overwhelmed and broken back into siloed chunks. But despite these challenges, one of the most exciting parts of this work has been to identify some of the promising practices and infrastructure that Vermont's early childhood system has. One of the most prominent is that the regional structure of CIS really reflects Vermont's values and commitment to centering local control and community. This was shared nearly across the board, where that the idea that having services centered in community prioritized relationship building and personal connections that fostered trust. We also heard that the flexibility of allowing a no wrong door approach, coupled with active coordination, can streamline navigation for families and providers. So folk have flexibility where they enter, and coordinators can help make referrals as needed. And Help Me Grow has also supported streamlining in some regions, especially after recent changes to the intake and referral processes to ensure quicker access to services. Multiple folk also talked about the benefit of Help Me Grow housing the ages and stages questionnaire. So focusing next on promising practices, collaboration was held up as a key facilitator of supporting excellent care, especially for more complex cases. Something else that was celebrated throughout our interviews was the intentional centering of families, making sure that trust is prioritized throughout families' journeys. And then finally, folk talked about practices like co-locating services in a single physical location and having set up data systems, internal data systems, or data sharing partnerships that as other key facilitators in the current system. So building from what we learned, our report offers actionable recommendations, summarizing what we heard from participants and suggestions of our own that rely on both our understanding of Vermont's context from doing this assessment, as well as our knowledge of the broader field. So starting with what we heard in our own data collection effort, our report outlines the recommendations that we heard from participants about potential changes that could be made to the system, and those really range from both potential effort and impact. Those included suggestions from translating key resources to ensure families who speak languages other than English can access information that range all the way to calls for building a statewide data system. In the interest of time, I'm going to focus on our recommendations, but we welcome any questions at the end. So moving to the next slide. So one of our key recommendations was to establish a state task force to explore options and make decisions about next steps. Some folk here, including Beth, will be on the task force, so we're really looking forward to kicking that off. And this task force is going to help determine the most appropriate CIAR system for Vermont. In all systems, we heard consistently that folks wanted to ensure there is a centralized access point so that families and providers who are not yet connected can find services. So this could look like making a referral form available online, ensuring it goes through user testing, and then prioritizing awareness of that access point. And we also heard that it's really important that the system has a consistent process for closing the loop on referrals. There'll need to be a focus on determining staffing needs, capacity for changes, establishing a plan for governance and oversight. Another key step will be noting which services should be included in CIR, noticing the desire for coordination, but also recognizing the feedback we heard from participants about not wanting to coordinate too many services within a single system. I think this also loops back to some of what Renee and Katie were talking about the need to coordinate as all these different initiatives are going on. And then the task force will also consider if there are some services that are currently only offered in some regions that should be expanded and take steps to cost model what system changes would take. As the state is making decisions, we heard a real need to bring in non-state partner and family voices through regular mechanisms, and you'll hear about how we're doing some of that. And then finally, the most common recommendation from all participants was to have a shared data system. And we've seen that in all the different successful CIR systems that we've seen in the field. So that is a real necessity, and working on it is crucial. So I'll hand it back to Anna to look forward to phase 2.
Thanks, Jess. I'll provide a very quick preview of phase 2 as we're actively launching this work now. So the goal of our work this year will be to operationalize what we learned about and recommended under phase 1, as you just heard, supporting the state to select, cost model, and plan for a statewide approach to a coordinated intake and referral system for early childhood services. We'll really be focused on identifying priorities for change, such as potential transformation for different features of the system, such as how it is housed digitally, and where we can identify the state's top priorities for investment and improvement. So if you think about how we'll accomplish this goal and look at all of these actions listed on the slide, our team will provide support by managing and planning project logistics and ensuring strong alignment and coordination. We'll support the state to select the key features and levels of transformation by first conducting assessments to dig deeper into needs around components such as data and technology, staffing, workforce. And second, facilitating activities with the state task force and other key partner voices to ensure our final decisions are well informed. We'll also conduct cost modeling to understand the cost implications of various choices. And finally, we'll plan for and summarize next steps for the implementation for the model that ends up being selected. Lastly, this is just a quick glance at our timeline. We're somewhere right in between launch and gather input as we have our first task force meeting next week, which is super exciting. Well, thank you so much. We'd love to have some time for any Q&A. I can stop sharing and peek at what's in the chat.
Thank you, Anna and Jess. And we can move to questions. I'm going to pause our, sorry, I should finish up. So I know we are coming up at time, just a few kind of committee reminders is that we are kind of shifting this group with our new strategic plan. We are kind of restarting certain strategic plan committees, including this one, to focus on goal 2 or many of those issues. Of course, there's a lot of interconnection. And so I put out a link for a survey trying to get a sense of how folks wanted to stay involved. Also identifying where who else we feel like is important to be around this table. And so I would say most of you on this who are in this meeting so far have responded, but if you have not, I put the link in the chat and would love to hear. So we are formalizing membership, though the meetings remain open and public, but feeling like having a better sense of some consistency in attendance and membership will help us in both monitoring the strategic plan and identifying those gaps and needs and how we might respond and where that information might need to go. So taking that information, we'll communicate with folks and also trying to figure out when our next meeting will be. We're generally meeting 4 times a year. Thinking about a meeting related to community safety and the pressures that families and providers and communities are feeling with the increased ICE occupation in our state and the impact that is having on many of us. And so if you have thoughts about what you would like to hear, what is important to have in that conversation, would love your thoughts as I plan for that meeting. Don't have a specific date yet if we'll do that in April or perhaps in June, but feels very timely. The other invitation is our BBF is hosting our annual strategic plan summit. It'll be in person this year on May 18th. We'll be at Zen Barn and Waterbury Center. So would love to see all of you there. If you've not registered, please do. It's a lovely space. We're providing coffee and breakfast. And it's a time for us to come together with folks from across the state to really think about how are we doing to meeting some of these big goals that we have, and how can we work together better? What needs to be messaged to be able to make the change that is needed? So please join us for that. So I think with that, we are at time. Thanks for joining. It was really great to see y'all. And thanks for the presenters for all your preparation. Appreciate it.
Yeah, this is a great
Thank
conversation.
you.